Okay, hello everyone. This video is all about cubital fossa. Now, why we have to study cubital fossa? What is the importance of cubital fossa? Because a lot of important structures pass through this cubital fossa. So we need to study about cubital fossa because whenever there is damage to the elbow joint or there are fracture, if at all there is fracture of humerus happening at its lower end, then there is a high probability of any damage occurring to the contents passing through this cubital fossa. So why the name cubital fossa? Because cubitus, what is cubitus? Cubitus means elbow. Above this, all these contents of cubital fossa are passing above the elbow. So this cubital fossa is also called as antecubital fossa. Anti means above. So cubitus, elbow, anti, above elbow. So antecubital fossa. So this fossa itself it is a triangular hollow space. Obviously, triangle has a base and an apex. Here, the base is formed by a line joining two medial epicondyles. These are the two medial epicondyles, and the line joining it forms the base of the triangle. And the apex of the triangle is formed by the joining of the brachioradialis muscle and the pronator teres muscle. The apex is formed by their joining. And now let's get into the boundaries of this cubital fossa. What are the boundaries of it? Now there is a lateral wall and a medial wall. So we have seen here the apex is formed by the joining of the two muscles, brachioradialis and pronator teres. So obviously the lateral wall is formed by brachioradialis and the medial wall is formed by the pronator teres. So if you see this diagram, this is the lateral this is the lateral side and this is the medial side. Now, lateral side is formed by the medial margin of the brachioradialis. This is brachioradialis and this is pronator teres. Now, the lateral wall is formed by the medial margin of the brachioradialis and the medial wall is formed by the lateral margin of pronator teres. Don't get confused with this. So, floor. What is the floor of this cubital fossa? The floor of cubital fossa is formed by two muscles, especially brachialis and supinator. Brachialis and supinator muscle. Here this is brachialis muscle and this is supinator muscle. Brachialis muscle passes through the cubital fossa and forms its floor and inserts on the coronoid process of ulna. This is ulna and this is radius. On the coronoid process of ulna, it gets inserted, and the supinator muscle, it winds around the radius and it inserts to the shaft of the radius. So this forms these two muscles forms the floor of the cubital fossa. Now this is the cubital fossa. Now the roof of it. What forms the roof of the cubital fossa? Obviously the skin first, then the superficial fascia, deep fascia, and bicipital aponeurosis. I'll get to bicipital aponeurosis in few minutes, but now we need to study about the superficial fascia. It is important. Why it is important? Because there are few important structures passing through this superficial fascia. Now superficial fascia has two veins, mainly cephalic vein and basilic vein. Here if you see here, the number 1 marking over here, it is cephalic vein, and the number 4 marking over here, this is basilic vein. So interconnecting both the cephalic and basilic vein is a medial cubital vein, which exactly passes through the at the superficial content. It is the superficial content. Medial cubital vein is the superficial content of the cubital fossa. It is an interconnection between cephalic vein and basilic vein. This is medial cubital vein. Now, along with this cephalic vein, there is lateral cutaneous nerve of forearm running along with it. This is lateral cutaneous nerve of forearm and running along with the cephalic vein, and this is medial cutaneous nerve of forearm running along with the basilic vein. Right? Got it? Cephalic vein along with it, lateral cutaneous nerve of forearm. Basilic vein along with it, medial cutaneous nerve of forearm. Interconnecting cephalic and basilic is the medial cubital vein. What is its importance? I'll say in few minutes. Now, what are the contents? Main important thing. What are the contents? Why we need to study about the contents? Because a lot of important contents are passing through it. What are those? Now, you can remember the contents of cubital fossa with a classic mnemonic. It is MBBS. Yeah, MBBS. This is from medial side to lateral side. First comes the median nerve, brachial artery, bicipital tendon of biceps brachii, and the superficial branch of the radial nerve. Now let's start with the radial nerve. Now this is the medial side, this is the lateral side, this is the radial nerve. A radial nerve coming from the posterior compartment of the arm. This is arm row. So coming from the posterior compartment of the arm, it enters into the cubital fossa and it passes deep to the brachioradialis muscle, and in the cubital fossa it divides into superficial branch. This is superficial branch and this is deep branch, and the deep branch, it is also called as posterior interosseous nerve. It enters into the it passes deep through the supinator muscle. This is the supinator muscle. It passes deep to the supinator muscle and enters into the posterior compartment of the arm. Sorry, posterior compartment of forearm. It is not arm. So this is arm. So this is forearm. So it passes deep to supinator and enters into the posterior compartment of forearm. Right. Now we have completed with the radial nerve. So the superficial branch is a main content of the cubital fossa. Superficial branch of radial nerve is the main content of the cubital fossa. Now getting into tendon of biceps brachii. Tendon of biceps brachii. We know the biceps brachii muscle. It has two heads, short head and long head. It gets inserted. It gets inserted to the here. There will be radius. Here it gets inserted to the radial tuberosity, and now the cubital fossa content, it forms as a cubital fossa content, the tendon of biceps brachii. And now the tendon of biceps brachii, if you see, it passes lateral to the, this is brachial artery, it passes lateral to the brachial artery. Now it gets inserted, I have said that it gets inserted to the radial tuberosity of the radial tuberosity, right? So after getting inserted to the radial tuberosity, it also gives bicipital aponeurosis. What is bicipital aponeurosis? It is a form of modification of the deep fascia. It's like, this is the brachialis, biceps brachialis tendon. It gets inserted to the radial tuberosity. Now it gives bicipital aponeurosis, which forms as a protection for the neurovascular bundle, like to the medial side of the bicep brachii tendon. What are the structures? We have seen MBBS from medial to lateral. So this is the brachial artery. This is the median nerve. So this bicipital aponeurosis forms a covering over brachial artery and median nerve and forms a neurovascular bundle, which gives a good protection to these two structures medial to the biceps tendon. Now what are the other two contents? We have completed superficial branch of the radial nerve, biceps tendon. Now coming medial to the biceps tendon, it is the brachial artery. Brachial artery, and it is a continuation of the axillary artery. It enters into the arm, and now in the cubital fossa, it divides into two branches. Here we have seen it divides into two branches, radial and ulnar artery. Now radial and ulnar artery, radial branch goes into the forearm, and the ulnar branch, which is here, this is the ulnar branch, passes deep to the deep head of pronator teres. These are the two heads of pronator teres. So it passes deep to the pronator teres deep head. So pronator teres has superficial head and deep head. So deeper to this deep head passes the ulnar artery. Now the next content of the cubital fossa is the median nerve. Now medial to the brachial artery, this is the brachial artery, right? So medial to the brachial artery is median nerve. So medial nerve arises from the brachial plexus, both from the lateral cord and the medial cord. So the medial nerve, what happens is that it is present laterally to the medial epicondyle of the humerus. Now what is the importance of it? It passes in between the two heads of pronator teres. I have said that pronator teres has two heads, superficial and deep head. It passes in between these heads, right? If at all this is pronator teres, now median nerve passes in between these two heads, and there is brachial artery over here. Brachial artery passing deep to the deep head of pronator teres. So deep head of pronator teres separates brachial artery and medial nerve. So pronator teres, I'll change the color. So this is pronator teres deep head, superficial head. Now this is median nerve. This is brachial artery. Now the pronator teres deep head, this is the deep head, this is superficial head. Deep head separates brachial artery and the median nerve. So that's what I was going to say. So these are the contents of the median nerve. Median nerve, what is the importance of median nerve? Supplies the flexor muscles. It supplies the flexor muscles of the forearm, right? Now let's talk about the clinical anatomy related to the cubital fossa. First of all, brachial artery pulsation, brachial artery auscultation. We can auscultate the brachial artery pulse in the cubital fossa. We know that brachial artery is the content of cubital fossa, so we can auscultate the brachial artery pulse in that area. Now the second thing, whenever there is supracondylar fractures, what is supracondylar fractures? Like this is the humerus, lateral epicondyle, medial epicondyle. The area above these condyles is called supracondylar area. Now any fracture at this point is called supracondylar fracture. If at all there is a fracture occurring over there, there is high probability that damages the content. It damages the contents of the cubital fossa. The next thing, medial cubital vein. Medial cubital vein, one of the important content of the cubital fossa. It is a common site for venipuncture. And another importance of medial cubital vein is that whenever there is a patient of renal failure, they undergo usually hemodialysis. What happens is that there is arteriovenous fistula made on their forearm that happens like between the brachial artery and the medial cubital vein. This is the medial cubital vein and this is the brachial artery. This is the fistula between them, and through this fistula the doctor takes out the wastel blood and imparts the new and fresh blood. So this is all about the cubital fossa and all its contents and its importance, why we have to study cubital fossa. Thank you.